Hello, and welcome back to the Modeling Success in Action podcast. I'm your host, Jessica, and today I am joined by Dr. Catherine Multari. So, Dr. Multari is a Vancouver-based naturopathic doctor. Her practice is focused on integrative cancer care and menopause care. She's a fellow of the American Board of Naturopathic Oncology and Menopause Society Certified Practitioner. When not working, you can most likely find Dr. Multari outside running, cycling, or hiking around beautiful British Columbia. Welcome to the show.
Thanks so much for having me, Jessica.
It's so great to have you. I'm excited to have this conversation. It's been on the books for months now, so I'm personally very excited to get to sit down and chat with you.
Likewise, and I'm glad it's being recorded as well because when I chat with you off the mic, I'm always like, these are such good conversations. We need to be having them for others to listen in on.
Yeah. So recently I've had lots of opportunities to watch how fantastic Dr. Multari is. You know, she and I have actually shared a lot of clients. And so I've heard secondhand from those clients just, how supported they're feeling. But recently we just ran a couple of menopause talks at the clinic here at Pleasant Hypnosis that Dr. Multari has been the primary facilitator of. And the feedback on those talks has been incredible because you really you're a wealth of knowledge when it comes to, moving through that hormonal stage of our lives. I mean, personally, I learned some things that I was like, I had no idea that that was the case. And I feel like that really kind of is the situation with a lot of women is they just don't know how to sort through the clutter and what's the real information and what's worth telling your doctor about and what's not worth telling your doctor about. So thank you so much for being willing to show up for that and be a resource. But I'd love to hear a little bit about what got you even, started on this path. Like why do you, show up
Mm-hmm.
like this?
Mm-hmm. Well, it's interesting you say that because I think it describes a lot of why I do what I do. So I feel like I've always had an innate calling to help others. Like I've always been a very compassionate person by nature, I would say. And that's really what led me to pursuing a career in healthcare and in medicine. Naturopathic medicine, particularly because I loved the additional time spent building relationships with patients and really understanding their health in a very holistic level. So even outside of the treatment options, which also resonate with me greatly in terms of using, least amount of force and using higher force interventions as needed, just the building of the relationships and spending time with my patients and really getting to know them is really what led me into naturopathic medicine. And then for whatever reason, I've had this calling to work with a more either vulnerable population or population that just may be underserved. So, for instance, my personal background is in athletics. I spent a long time as a high level athlete myself. And so, when I was in naturopathic medical school and we were talking about kind of what area of medicine do you want to focus in, originally I just thought, based on my personal experiences, I would be well suited for something like sports medicine, and that's what my undergrad degree was in kinesiology as well. But when it came to what I'm going to be doing for the rest of my life, I just felt sports medicine was just not dynamic enough for me. But then also, I just felt like I don't want to be helping, like it's great and it's needed to help people go from like their 80% to their 100% to reach their optimal performance. But I want to be really helping people who are really, really struggling and be with them at like a really tough time during their life. So that's what ultimately led me to first kind of focus in integrative cancer care. And I still do some of that now. And then it was in that integrative cancer care journey where I started having a lot of patients who were younger being diagnosed with cancer. So patients in their 20s and 30s going through a premature menopause, and realized I knew a lot about oncology, but I didn't know a lot about menopause. So then I branched out to learn more about menopause care. And I really, really enjoyed learning about menopause care. But what I was surprised to know, which is what you're alluding to, Jessica, is how much lack of education is out there. Like I just was a little bit naive in thinking, every female kind of goes through menopause. Like there must be good education and good treatment in the average population, but that wasn't the case. So I feel like more and more inclined to continue to pursuing helping women in midlife because I feel like women's health in general is a little bit under researched, although things are improving. But menopause, like there's a sense of ageism even. And there's so many women struggling and so many women that all I want to do is be able to provide them with these information. So those talks truly, truly light me up, like truly light me up. Like I really, really enjoy doing talks talking about midlife hormones, midlife health. Like every time I've done many, many of those talks in the last few years, and every time I leave, I feel my cup is full.
Yeah, and I feel like it does tie into that the entire naturopathic, ideal of starting with the lowest impact, right? Like,
Mhm.
and then working out, like just simply educating people so that they can be on top of it and know what their options are and their choices, right? Because so many people, like, it's like they're wandering around blind and just hoping that like something happens versus being real, active, members in their own health. Yeah.
That's true, and I didn't even think of it to that point, but it's true. Even just educating individuals is the best thing you can do to just build the foundation.
Mhm. Right? Yeah. And
Mhm.
then they know, okay, cool. Now we're looking at vitamin D and going outside and,
Mhm.
picking our creatine and all of that. So, okay.
Yeah,
Yeah.
yeah.
So then as you've been, having this experience, like, okay, so first of all, side note, did you ever consider being a GP? Because you do mention that naturopaths get to spend a lot more time. You do get to
Mhm.
do a lot more of the background and kind of hold the space for your clients a little bit more than a GP does. So did it ever cross your mind to be a GP?
Yes,
Yeah.
yes, because I grew up in Windsor, Ontario, which is now things have changed a bit, but when I was growing up, it was one of the major automotive capitals of North America. Very blue collar. Most of my, yeah, like very blue collar, very westernized. And so, I mean, when I was growing up, none of my friends, not nobody went to see a naturopathic doctor or even knew what that was. Like that was, a small town, like you are in an area where you become kind of like these known professions, like a doctor, a dentist, a lawyer, a teacher, a nurse, like very like inside the box thinking. So I knew I wanted to be a doctor and just assumed that was a GP. And it wasn't until I was an athlete that I realized, like, why is my GP only, having a short visit, and why, like, is my GP not asking more questions and not I saw my parents, for instance, like struggle with like more chronic health issues and be given medication. And it's like, this is when I was kind of thinking about medicine myself. And I'm like, why is he not talking to you about, exercise and diet and even giving you handouts on things that you can do? And so that's that. At that point, I thought, okay, I wasn't even aware naturopathic medicine existed, and I thought, okay, I want to be a GP, but I'm going to be this outside of the box GP. So I kind of was pursuing this path of I want to be a doctor, but this more different, holistic type of doctor until one of my friends in university finally said to me, "You mean you want to be a naturopathic doctor?" So I was like describing this profession that I didn't even know existed, more or less. And so yeah, that's ultimately how it kind of played out.
Mhm. So you clearly value being able to really dig into like the history of what's happening with the client and like get to the root cause of what's going on. So having the space to have time for that. So what else were you
Yeah.
valuing in this, this model that you were making up in your mind when you were
Yeah.
thinking about the direction you wanted to go?
I think also the problem solving. I think
Hmm.
the problem solving is big for me. So when I was in high school, like I knew I wanted to be a doctor, and I had some like kids in high school at my high school could do co-op placement, and oftentimes co-op placement were for individuals who are interested in the trade. So like they would go work at an auto shop or do things like that, but I really wanted to do a co-op. And so what I did is I set up a program for myself where I went to the hospital, and at that point I was really interested in diagnostic imaging and thinking of becoming a radiologist. Actually, this was in high school, so a long time ago. But I would spend like every day of the week, like one day in ultrasound, one day in X-ray, one day in CT scan, MRI, etc. And then most of the day I would just be with the technician, but for a small period of time I'd be with the radiologist, maybe just 20, 30 minutes a day. And I thought I wanted to be a radiologist, but then I realized like radiologists unfortunately don't deal with patients. They read reports, which I loved that piece of it. Like I loved like I still think that they're incredible. Yeah, it's an incredible profession, and that's really neat what they do. And I love the problem solving around that, but it wasn't enough patient contact for me. And so that's where I wanted to go into kind of like direct patient contact position. And then also and that's where I say like I felt like sports medicine wasn't dynamic enough for me. After doing an undergrad degree in kinesiology, doing a ton of anatomy, ton of physiology, and then repeating the anatomy in naturopathic medical school, I'm like, okay, I know all the bones of the body, I know all the ligaments of the body, like those aren't going to change in my lifetime, right? But in oncology, like it's so fascinating. Like even just how we detect cancer now, like screening programs are always changing. How we detect cancer now, like is going to be different from 10 years ago, like, or 10 years from now. Like in 10 years from now, there may be a blood test that screens for cancer. Like, could you imagine that? Like not needing a mammogram, having a blood test.
Yeah. And
And
not needing to
that's,
go in for like an invasive, like a biopsy or something, like
yeah.
they can
And
just
that's
tell.
not, yeah.
Yeah.
And that's not far off and it's not too far out of the realm to consider for our lifetime. And even still within my lifetime, like, when my grandmother was going through colon cancer, there was no such thing as a PET scan, which like blew my mind because me, only being in medicine for the last 5 to 10 years and education in medicine in the last 10 years, I couldn't imagine not having a PET scan because it's a type of imaging that's so common in oncology. And so to hear like, even in my grandmother who had colon cancer, that they were doing like somewhat of an operation that like was exploratory, like they were kind of opening her up to see what was there, and that is like, yeah, that is far from what happens today. So I love the dynamic nature of oncology, and that's one of the big reasons that I was really leaning towards that field as well.
Mhm. So you wanted to pick something that you could be forever engaged in.
Yeah,
Yeah.
forever engaged, totally. Forever engaged and forever learning. It's like once
Yeah.
you, yeah, feel like you've I think there's a benefit in terms of mastering things, but I feel like, yeah, and I feel like menopause care and oncology kind of balance each other out for that. Because menopause, like I feel like oncology is so tough because you can learn it and practice it for a lifetime and still feel like you don't know anything. Like that's how I constantly feel in oncology, is as much as I've studied and work with cancer patients every week, and read the research articles. It's like definitely the type of thing where you feel like the more you know about something, the more you feel like you don't know.
Mhm.
Um,
So,
yeah,
okay. So a lot of doctors, we look at doctors as like the authority, and there can be a bit of an ego around some. I mean, I know I've experienced this for
yeah,
myself firsthand, going in to see a specialist, and you ask them a question, and this is the only thing they do every single day, and so they're looking at you like,
mhm.
you should know this, even though they know it. So like, how do you reconcile needing to be an authority and an expert in your field, and also being humble enough to realize that you don't know everything? What's that like for you?
Yeah, I mean, I think ultimately like you can like there's knowledge, but then there's also critical thinking. And I feel confident in my critical thinking abilities, even if my knowledge is not 100% there. Like, and 100% there meaning there's always more to learn. Like there's always something that, somebody's not going to know. And I think when I kind of focus in an area that's so incredibly broad, like it would be one thing if I did just breast cancer alone, but I see all types of cancer, so it's so broad. So there's no way I could know everything. But I at least there's a few things. Is one, having confidence in my critical thinking abilities, but then also having, I think it's important to have confidence to know your limitations and know when you don't know something. And I don't have a problem being able to tell a patient if they ask me a question like, I don't know the answer to that, but I'm happy to look it up. Or sometimes I ask them to ask one of their other providers who I think would be more skilled in answering that type of question. Because sometimes, for instance, patients ask me like very, very detailed questions on, so I have this receptor mutation and have undergone these 5 different types of treatment. What is the what percentage will I reduce my recurrence by now doing radiation? It's like, okay, well, I think you should ask the radiation oncologist that because they'd have a better answer than me.
Hmm.
Yeah.
Yeah.
So.
So your ego stays intact because you trust like your ability to be critical about your choices, and even your critical thinking is going, hey, let me refer that out. Like, let me point you in a
Mm-hmm.
different direction, right?
Mm-hmm.
Yeah.
Absolutely.
hmm
Absolutely.
So I think that that's something that can be applied to like every profession. Right? Yeah.
Yeah, I think it's yeah, and I think it's so normal to say like I don't know everything. Like I think it's a red flag for somebody to say that they do know everything and that there's not new research on this and
hmm
that type of thing. And I also think like research is the best that we have, and so it's important for us to recognize research and use that to make research informed decisions, but also to realize that it's not everything. Like we have to take what we're seeing in front of us. And I mean, that's especially important for me as a naturopathic doctor because I do find in general, not so much in my specialty care, but say I was just doing a general practice, I do find most patients are coming to naturopathic doctors if they're just coming for general concern because they haven't found answers in the traditional system. So if you have a patient, if you were running a general naturopathic practice and most of your patients were coming to you because they hadn't found answers in the traditional system, well, these patients very well, you could have a high percentage of people who are kind of abnormal responders, who the research kind of summarizes like what they're seeing in the majority of people, and you may have a higher amount of people that you're seeing who don't quite respond to normal treatment. So I think like over the years, I have seen patients that, if the research says even something simple, like if the research says that IUDs do not cause weight gain, and the patient is telling me like, I have not changed my diet, I have not changed my exercise, I got this IUD and then I gained X amount of pounds, like I don't know what else it could be. I think I'd be doing a disservice just saying to the patient, I'm sorry, the research doesn't support that. Like is like I could say to them, okay, the research doesn't support that, but I trust your experience. So like let's think about, and that's where the critical thinking comes in, is let's think about how is this possible? How is it possible that an IUD can cause weight gain? Is it a foreign body in your system that's creating an inflammatory response, like a somewhat immune driven response? If that's the case, what treatments can we use that can kind of down regulate the immune system? So having to not necessarily follow like algorithmic type of treatment and algorithmic type of medicine allows me to really use those critical thinking abilities, which I really enjoy, honestly.
Yeah. It sounds like it's a fun job.
Yeah, it is. It is. Yeah.
So, so if the people that are coming to see you, they're specifically like in oncology, or like, they're referred to you for the menopause clinic, but if they're just like you said, a general, person that's not responding to classical interventions, a lot of the time what you're suggesting is maybe outside of the box, right? Or it has
Yeah.
more to do with lifestyle or, mood or
hmm
attitude. How do you support these clients in being able to make those changes when it's not just a pill?
You have to have a really highly motivated patient population. So it's interesting talking to you, Jessica, because I think like when individuals ask me like why did I get into like the area of medicine I'm in, like I could talk about one thing, but I think it's so many things. Like this kind of gets me to I always also wanted to work with a highly motivated patient population. And so obviously patients in the cancer care realm are highly motivated that are coming to see me. So I fortunately don't have to worry too much about adherence. Most of my patients are pretty good, I would say. If I have troubles with patient adherence, I usually refer them to you.
Yeah. Yes, this is true. I have seen a few people who've had to make a huge, shift in lifestyle to get the outcome that they're looking for health wise. And they tend to do really well with that. Yeah. Yeah. So then when you're looking at, the current terrain of cancer care and menopause care, like what does it look like right now?
So I would say, I mean, if we're starting with menopause care is really interesting. I feel like more women are talking about it now, which is fantastic, which is really, really fantastic. So I feel like currently the terrain of menopause care is more women are talking about it. There's more podcasts about it. There's more books about it. It's kind of the most commonly talked about things in women's circles that around that age. but then accessing care can be kind of hard because, for instance, I put on these educational events and say, okay, we should be getting our blood work done, but then not every family doctor thinks that patients should be getting their blood work done every year. So current menopause care, I would say the education, I'm hoping to see the pyramid kind of build from the bottom up. The education piece, where I feel like was very narrow 5, 10 years ago, we're building that out now. And we're lacking a little bit more of like the next step is patients can kind of do everything they can on their own lifestyle, um, which means like sleep, stress, nutrition, mindset. And then if they need further support going up the pyramid, hopefully we can see more practitioners wanting to be trained in this area to better support their patients.
Mm-hmm.
So that's currently what I'm seeing
Yeah.
in menopause care.
And are you enjoying what you're seeing, or do you want to see different things happening there?
I think overall it's good because like I have to compare it to where we were and where we're going. So yes, we're not 100% there, but I do feel like we're moving in the right direction, which I think is overall positive. So I mean, we're not fully there and there are still some gaps, but I fortunately feel like that is moving in the right direction. Another really good thing is in the province of British Columbia, our government has um, agreed to cover menopause hormone therapy, which should be coming in the next few years. So women won't have to pay for their treatment. So I think that will also improve access. So I think it's really just a matter of time for the menopause care to really improve across the board to all women in all areas and have access and trained providers. And I think also with the education piece, I think we will start to see too more advocacy for better education within the medical schools as well. So I do see that actually improving slowly in the right direction. Um, the cancer care, on the other hand, I think is a bit of a tougher one because we're seeing cancer rates increase, especially in the younger population, which really creates a lot of interesting dynamics. One is for instance, like there's so much more I need to learn than just oncology. Like one is supporting menopause and helping patients going through premature menopause in their 20s and 30s. Another, which is an area that I haven't really wanted to kind of specialize in, but have to at least have a basic understanding in is pregnancy and fertility, because if individuals are getting cancer diagnoses in their 20s, 30s, and still wanting to have a family, that's becoming a lot more common. And so that's something I'm seeing in the cancer care realm. And I think cancer care is a lot more challenging. I think we do just live in a more toxic environment, and we kind of carry the toxic load, like what our parents were born with, essentially is passed on to us. So we already start a little bit more burdened and with higher risk of cancers than the generation above us.
Mm.
So oncology is a little bit, I think, more challenging in terms of just like calming the storm
Mm-hmm.
and improving care overall.
The environmental toxins, like the microplastics and all the smoke in
Yeah,
the air and all of this
you got it.
lovely these chemicals that's in our DNA, and as we're having children, we're passing that along to them, and they're growing
Correct.
up with all those things already in the system.
Correct.
How
Yeah.
fun.
Yeah. So I mean, how to address those things goes back to like the basic, like how to optimize health from like a baseline standpoint of lifestyle, mindset, etc. But yeah, the oncology, yeah, there's a lot of work for anyone who works in oncology these days.
Yeah.
Yeah.
So when we're looking at like the landscape of things, it's, the science is getting better, but the situation that we're in seems like it's kind of maybe getting worse, right? Even though the
Yeah.
the science is trying to catch up to it. So then what do you do to get your patients to be able to start supporting themselves? Do you start with, like just a general information? Is it mindset? Like how do you let these people start to become advocates for their own health? Because you're saying you want to work with
Yeah.
highly motivated
Hmm.
patients. So what lets them be highly
Absolutely.
motivated?
I think the biggest one is being in tune with their own body. And it's interesting because like if you're whether you're focusing on it's so applicable whether you're focusing on your health or focusing on your mindset, which seem can be two seemingly distinct things. One is focusing on the physical and one is focusing on the mental.
It's all one though. They feed into each
It's all
other.
one. It's all
Yeah.
one. And the first step of I truly think the first step of either one, the physical or the mental, is first looking inwards. And when that means when we're looking inwards, if we're talking about the mindset, it's like, what are your thoughts? Right? What are your thoughts and what are your feelings around those thoughts? Which so it's
Right.
mental and
It's kind of
physical.
like looking at your diet. Like, what are you taking a daily dose of? Right.
100%.
Yeah.
And then on the physical side, it's not just looking at, how many hours you're sleeping, what you're taking in, but how do you feel? Like, are your joints achy? Like, are you noticing any lumps or bumps on your body? Like, how do you feel? And for instance, like that's really where I think it begins because yes, we have screening programs and we can be really pushing individuals to keep up with their cervix screening, their breast cancer screening, etc. But the really first point is looking inwards because if you're looking inwards, you're going to notice if you've all of a sudden coughing up and there's blood in there. You're going to notice if there's all of a sudden blood in your toilet bowl. You're going to notice if there's all of a sudden a lump on your breast. These are small things that some people don't notice. And so that's, I really think, the first step in terms of getting like being motivated in terms of your health is doing a self audit and really getting in touch with your body. Um, yeah.
Yeah, I don't know how often I hear people saying that, like, I don't even have time to like check in with myself. I don't even have like 2 minutes a day, 5 minutes a day to like breathe deeply and check
Wow.
in. And it's wild. And the truth of the matter is you totally do, but it's again, it's the
Oh,
mindset. It's the way we're putting our focus. And unfortunately, in this day and age, our focus is so split that, we're focusing on our phone and not realizing it. How many times have the people listening, how many times have you personally gone to check your phone for the time and put the phone away and realize you don't know what time it is? Right?
yeah.
Like it happens. It happens all the time. So being willing to acknowledge that is, yeah, it's pretty powerful stuff.
Yeah, absolutely. Like being present and being mindful is
Yeah.
so important. And it's not even about, yeah, like the first step is just checking it. And I think it
Just,
will build on that.
yeah.
And I think when people think about mindfulness, they think about the steps that you build up from.
Mhm.
But the first one is really just, yeah, checking in. And it honestly surprises me so much. Like it surprises me so much. And I think there's possibly some level of fear, definitely level of busyness and stress coming in. But for instance, like I had a patient who had an early stage breast cancer, was treated fully for that from the Western perspective, and she sought out integrative treatment. And so her first breast cancer was on the right side. Then she had not a recurrence, but a new breast cancer happened on the left side. And um, this patient was, and so many things could have been playing into it, and it's not the patient's fault at all. But the patient was somewhat in denial. She found they found the lump of the new cancer on routine imaging, but I was really surprised. Like we did a physical exam in office, and this was like while the patient was waiting for the biopsy results back, and the patient was unsure if she wanted to go forward with treatment. I did a physical exam and I said to the patient, I said, yeah, like, we can wait for the biopsy, but I'm fairly positive this is going to come back positive. Like this is what this looks like. And the patient was okay with that, but I was just really, really surprised. And a patient who has even had breast cancer before, who wasn't able to even pick it up, right? It was a screening exam that picked that up. So I really try to encourage, and sometimes, yeah, like what we encourage and what's being done in day-to-day life, there's sometimes a gap there. And that's why I send patients to you to kind of help fill that gap. But I just think, yeah, like in that case, screening really helped us, but we should really, really be in touch with our body. We should be doing, like when I talk about doing a self breast exam monthly in the shower, like either the first day of the month, whatever makes most sense for an individual. But it's really, I tell them, you're not looking for a lump or a bump. Breast tissue is naturally lumpy. You're just getting in touch with what your normal is. And this doesn't just apply to the breast, it applies to kind of the whole body.
Yeah, so that when you can know when something's not normal, when it's off, and then
Mhm,
seek, some more information there from that point.
mhm,
Yeah,
mhm,
awesome.
mhm.
So I think we've covered like a lot of it, but is there anything else that you feel like you want to leave the listeners with today before we wrap this up?
I think that's it. Yeah, that's it. I'm happy that I was able to share that experience. Not many people kind of get an inside look of, yeah, as we talked about, like what the decision making is, how I'm thinking, and I think that was just really beautiful to be able to share that together. So thank you for giving me the opportunity to do so, Jessica.
Yeah, absolutely. It was a pleasure having you on here, and this conversation was just like all the others, very, very fruitful. So,
Mhm.
I'm going to leave all of Dr. Maltari's information in the description of this show. So if you want to reach out to her, she's got an integrative cancer care practice that she's doing primarily in one location, and then she's got menopause in another location. But if you have general needs, you can reach out to her, and she's there in all those spaces.
Mhm.
So I think I'm going to wrap it up. This was fantastic. You have an excellent day. Thanks for tuning in, everyone.
Thank you.